Good afternoon, everyone. My name is Amalia Cabigas, and I am the Community Safety Program Coordinator at the Medical College of Wisconsin Comprehensive Injury Center Division of Community Safety. And I am joined here today with my colleague, Anne. She is the statewide Community Safety Program Manager for the same division at MCW.
Okay, great. Thank you very much. So we're going to share our work with the Wisconsin Community Safety Fund. Let's see, and are you seeing my slides? Is everybody seeing? Yes?
Yes.
Okay. And are they in presenter mode or not? Okay, we're all good. Thank you. Sorry about that. So anyway, we're going to share our work that in Wisconsin with the Wisconsin Community Safety Fund, which is a grant program that we were able to start with ARPA funding. We'll start with some key definitions, let's talk about the structure of the fund and what it actually is funding in terms of projects, and how we hope that this contributes to a comprehensive statewide approach to community safety. And then we hope to take some questions or respond to comments in the chat. And so to start us off, Amalia is going to share a starter exercise with us through the Menti app. And so you can get your phones ready, and I will pass it over to Amalia to do that and introduce us to some key definitions.
Thank you. To kick off our session, we invite you to complete this Menti, which is an interactive survey tool displayed on the screen. So if you have your smartphone, iPad, whatever it may be, you can scan the QR code, or you can visit menti.com and enter the code at the bottom of the screen, 51943916. And then once you are in the Menti, you should see a fill in the blank question of community safety means ... You can answer this multiple times with what community safety means to you. Unfortunately, you won't be able to see the results real time, but on our end, this will form a word cloud, and we will share this with MIPA, and it'll be accessible to all of you to view after the conference. So I'll go ahead and give everyone a couple of minutes to scan the QR code, think about their responses, and answer the question. Perfect. So far, I'm seeing responses come in. We're seeing prevention, freedom, no more shootings, no hate crimes, support, peace, trust, awareness, education, no police harassment, health equity, awareness. These are all really great responses. We'll give it a couple of more seconds. Living without fear, long lifespan. Everyone being free to be who they want. Trust. Perfect. So moving forward, next slide, please. Here is the Prevention Institute's official definition of community safety. The Prevention Institute is one of the resources and frameworks that we use in our work. So safety allows people to thrive and live fulfilling lives. It is the freedom from violence and the threat of violence. Community safety is achieved when all people have the ability and opportunity to reach their full potential for health, safety, and well-being across their life course in thriving, equitable communities. Inequities are created by structural drivers such as racism, sexism, and income inequality, and disproportionately impact communities and individuals of color. So as you can see, there is a lot of overlap with your responses of what community safety means to you in comparison to the Prevention Institute's definition. For example, freedom, health equity. So that's great. Next slide, please. So moving forward, the next couple of slides cover two important definitions that pertain to our work. Here is the World Health Organization's definition of violence. Violence is the intentional use of physical force or power, threatened or actual, against oneself, another person, or a group or community that either results in or has a high likelihood of resulting in injury, death, psychological or emotional harm, maldevelopment, or deprivation. So feel free to take a second and reflect on this definition and put in the chat anything that stands out to you or anything that you find super interesting about this definition. For me, one thing that stands out in this definition is the use of power. This highlights the imbalances and inequities that exist within certain social structures like gender, race, or class, which can lead to individuals being disproportionately impacted by violence. Okay, next slide. So in order to address violence as a public health issue, it's important to look at it through a health equity lens. Here are the 4 active components of a health equity lens. Again, this is from the Prevention Institute. So it's implementation, inclusion, collaboration, and validation. Implementation promotes equitable access to and allocation of resources, inclusion of those who experience inequity, collaboration that increases protective factors, validation of trauma through healing and reconciliation. So in sum, while looking at violence as a public health issue and using a health equity lens, it's very important to uplift and to take into consideration the voices of those who are most impacted by violence and to center the work around it. And I'll hand it off to Anne. Thank you.
Thanks very much. So the Wisconsin Community Safety Fund was created as a way of funding strategies at the local level to address violence as a public health issue, taking a public health approach, and then also creating a community of practice of like-minded practitioners that come across sectors, across organizations, across issues related to violence, and really look at what happens when we take these key definitions and these key components and center implementation around that. And so that's what we're hoping to be able to share at the end of our grant period in terms of data collection and evaluation. The goal of the fund is to enhance safety and well-being for children, youth, and families through culturally specific evidence-informed violence prevention. We want everything we do, we look at in terms of, are we building awareness, capacity, and coordination for treating violence as a public health issue in the state of Wisconsin? And are we informing a comprehensive statewide approach to community safety and well-being? So ARPA funds were allowed to be used for violence prevention. Many states took them and funded community violence intervention strategies, or specifically gun violence prevention strategies. Wisconsin, we chose to make it open to organizations that were interested in addressing state priority or CDC priorities in terms of intimate partner violence, gender-based violence, firearm and suicide prevention, and also youth violence. And we thought that this was a good idea because not all communities across the state have the same needs in terms of violence prevention. Some areas see higher rates or higher prevalence of one form of violence over another. And so we really wanted this to be a statewide, reflect a statewide approach. So at the end of the selection process, there were 10 grants that were chosen to be implemented over 3 years, totaling no more than $1 million each. And 4 of them focus on intimate partner and gender-based violence prevention. 3 of them focus on firearm violence prevention, 2 preventing suicide, and 1 preventing youth violence through intensive mentoring and career and education readiness engagement. The 3 firearm violence projects are in the jurisdictions of the City of Green Bay, the City of Racine, and the City of Madison. Racine and Green Bay both opened offices of violence prevention to start work at that level. The rest of the grantees are project-based or organizationally based at the local level. It took about, let's see, the RFA was released at the end of 2022. The awardees were contacted at the beginning of 2023, and then contracting started. It really was, by the time contracts were executed and then funded positions were actually filled, it really was about Q3 of 2023 that we started seeing major implementation outcomes and data and results. And so at the end of Q3 2024, we have about 4 quarters of data that we're looking at. And just some highlights, there are about 51 positions that are funded through this $10 million grant fund across the state. That's not including our staff positions at the medical college that were created to oversee this program. 1 tribal nation is being served with this funding. 10 cities are being served with this funding, 29 counties. And this is kind of low at this point, but we've estimated that there are over 100 individual TA contacts that our staff has provided to the grantees in order to help them implement federal grants, implement their projects, start at evaluation and data collection, and that a really robust training and technical assistance program is a key component of what we wanted to build into the fund. And so everything has been structured around that. You're probably used to seeing this framework, but as I said, we draw really heavily from the Veto Violence website and the other CDC resources that are out there to educate practitioners what it means to do work from a violence prevention, from a social from a public health approach. And so always talking about the projects that are being funded and the work that we do in response to that to assist with implementation, talking to the grantees about what are the individual outcomes that they're seeing, the relationship, so in terms of bystander training, et cetera, impact at the community level, and then societally, what kinds of policies are they bumping up against that may be invisible, but that are affecting the participants in their projects and programs. The community of practice that we've that we structured around this is really centered around collaboration. And so peer sharing and learning, it's not top down, intentional meetings and activities that are structured around treating violence as a public health issue, the different frameworks, tools, and resources that the grantees can use to implement and inform their work, but also train and educate their communities in this approach. So as I said, we're not funding public health departments per se. And so a lot of the people that are implementing the work may be familiar with approaching violence as a public health issue, but it may not be their primary training. And there are a few drivers that we've centered in terms of driving our program. So the belief that equity is actionable. So by using CDC resources, we hope to build self-sufficiency in terms of communities being able to continue this work without a grant-funded technical assistance relationship. While we hope to be able to continue to provide technical assistance, if that funding landscape changes, because ARPA funding is ending, then we want people to be able to know where to access continuing updated resources and tools and data sources. We really want to make sure that we are collecting data in a way that we're measuring prevention and the impact of prevention, and we want to align our work with informing a comprehensive approach to community safety. And really what that means is making sure that we're plugging in to groups that are looking at this across, that we're connecting the dots across different forms of violence. In terms of indicators, because the projects are so different and focusing on different issues, it's not like, say, an overdose review commission or something like that, where you can pick one indicator and apply it to every grant that's in the cohort. But we did settle on connectedness as an indicator for safety. It is evidence-based. It resonated with the grantees, and it also consistently comes up when we do the mentee of define community safety. And so all these things together have led us to work with the grantees to identify connectedness measures and build that into their evaluation plan. And then looking statewide, we are engaging organizations, government, community, and networks around the vision of advancing public health approach to violence prevention in the state of Wisconsin, and shifting from not just preventing what we don't want to have happen, but aspiring to community safety for all people and the structural changes that we need to make to achieve that. And in doing this work, when you look at the state of Wisconsin, and this is true for a lot of states, there is, because of the movements around suicide prevention, domestic violence, and sexual assaults over the past decades, there are statewide networks often established to look at these issues. But there is not statewide networks that are dedicated to looking at community violence intervention or more directly firearm violence. And so in order to do true statewide coalition building and look at things comprehensively, we acknowledge that there is a gap in terms of statewide collaboration around community violence intervention in the state of Wisconsin. And so we're taking a lead to support that collaboration as part of this funded project. We're also taking the lead in developing a Wisconsin Community Safety Academy so that there's an in-state training network and entity to build the workforce around community violence intervention, and also to advocate on shared policies and practices. As I said, we center the Veto Violence website with all its tools. And connecting the dots on violence prevention is another key strategy to do our statewide work and to inform a comprehensive approach. And that's going to be the primary focus of our staff work and mobilization of the cohort community of practice in the year 2025, in addition to focusing on sustainability planning in terms of systems change, not just funding replacement, since the ARPA funding will be ending. As part of this, we're starting an alignment map in terms of what at the local level, the projects, how they align with city, county, tribal, state, and national efforts. And we'll do that, and then we'll cross-pollinate all of that with the statewide partners. And so in finishing, we would like to open it up to questions, but also invite you to do another mentee where you're really thinking about what type of violence is most prevalent or you're most aware of in your community, and in what order you think that they should be addressed. So it seems odd to rank forms of violence because it's not about importance. It's really about prevalence and sort of where your work is being called from a public health perspective. Because when we look statewide, Wisconsin is no different than other states where there are different primary concerns around violence depending on where you live and who you are. And so when we start thinking about a comprehensive approach, we really need to be mindful around bringing this all forward and acknowledging those differences to keep people engaged in the conversation.
Right.
So Malia, are people seeing the mentee? Is it
So
going?
looks like we're getting a couple of responses. As of right now, first is firearm violence. Second is, it's switching. Tied between suicide and intimate partner and gender-based violence. And then last is youth violence.
And I guess in closing, as we open to questions, and I'll need help seeing what's in the chat or question and answer, really just inviting everybody to take a pause and acknowledge that, we talk as public health professionals, as advocates, as practitioners, we talk about violence all the time, and we're so committed to seeing this, seeing rates of violence go down and seeing it eliminated for everyone. But the reality is it touches us all in some way. And so an acknowledgement of that and to take care of yourself and others in this work. Are there any questions?
Great, thank you for the wealth of information in the presentation. I'm not seeing questions. I don't believe that we're able, oh, we do have ones from Sandra. Do you have the outcome measures for community connectedness? And if so, are you willing to share?
I am willing to share how far we've gotten so far. I don't have them on hand right now, though. What we did was we came up with sort of a list of potential measures, and we are working with each grantee for them to choose what's most relevant to their work. But happy to share that. And I know that other states have started to do a lot of work, and there were presentations here today talking about connectivity and connectedness.
Great, thank you. I also was going to put a link to the session slides. I noticed that yours is on there.
Yeah.
So I'll add that to the chat box.
Yeah, and I meant to copy the link to our website, and there you can see what the funded projects actually are. And the range of those. But if you Google Wisconsin Community Safety Fund, it'll take you to our webpage, and you can find out more information. And you can contact us through that or through LinkedIn or through this event app, and happy to collaborate in any way to support similar work.
It looks like Tanya has a question about, do you have anything to share about the MMIP in Wisconsin? How are you including this in your work? Not sure.
I'm not familiar with that acronym.
It's for missing and murdered Indigenous people.
Oh, thank you. Yeah, moment of silence with that. We have not connected with that initiative yet, but would definitely in our 2025 statewide work. And there are no, the one tribal community that is funded through this, they haven't mentioned specifically participating in that, but that definitely is something that we could look at. Amalia, do you have anything to add on that in that regard?
No, I don't have anything to add. Just the fact that we are currently working with the Lakudere tribe right now.
I also noticed in the chat, thank you, Tristan, for sharing a link to the connection indicators inventory.
Oh, thank you. Thanks, Tristan. Different
And-
sources of.
So then Felicia's asking, what do you think about
Mhm.
different sources of connectedness? For example, social media has been seen both ways. Alcohol brings people together, but also causes violence.
Yeah, we have not engaged on that level in terms of commenting on which are more effective than others. So we're really looking at it as that the projects, the grantees will identify measures and see what kind of impact their work has on increasing connectedness for their participants and in their community.
I had a
Tristan
question.
or Amalia, would you like to put our website link in the chat?
Yeah, I'm gonna ask if Tristan could do that. It looks like I can only send messages to the host and panel.
Oh, okay. Thank you.
I apologize if you did mention this, but any discussions or efforts around like sustainability after ARPA funding is concluded? And again, I apologize if you did touch on that. And
No, thank you for picking up on that. So the way that we structured our community of practice is that over the 3 years together, since it's a 3-year grant period, the first year was really about teaching around violence as a public health issues to make sure that everyone has shared language. The second year has been about developing evaluation plans and project implementation and our own data collection to align with the sociological framework outcomes. And then the third is going to be sustainability planning. And so the Tristan, who dropped the link, is our TA education program coordinator, and he's going to be designing with collaboration strategies for sustainability that include, of course, include replacement funding, and if you're lucky enough to find that. But the reality is $10 million coming into the state of Wisconsin is not going to, as many of us are realizing, there isn't going to be that kind of same pipeline of funding. And so having them evaluate the type of work that they're doing, how much of the funds did they actually spend, how are there partnerships that could keep this work going in different forms? And so we'll be walking them through that type of a framework. So for example, one suicide prevention project that's located in Madison that's specifically doing outreach to the Hmong and Lao communities. They've already looked at how could their 3 staff people that are funded through this project, how could they become certified as CCS entitlement, basically case managers. And so they would still be able to be in the community and doing education on suicide awareness and prevention, and building those while still being funded. And so their work could still go on in terms of the impact they're doing in the community. And it just would happen in a different way. So that's just one example.
thank you.
Mm-hmm. So particularly in the outcomes that we're seeing in terms of how these grants have increased representation for traditionally marginalized groups who are carry a higher burden for violence. looking at those initial outcomes, there are sort of creative ways that the work could continue by creating roles at larger organizations that have dedicated funding. So whether it be a healthcare setting or a mental health center versus a culturally specific center, there are some conversations going on at that level. And then our Gunderson Health Systems, they're a crime victim services unit or program that's FOCA funded, so kind of a traditional sexual assault, domestic violence, advocacy and referral and therapy program located in a hospital. The focus of their project is looking at how you move screening and for violence and get earlier referrals, connect with people earlier when they may be experiencing violence. And there, one specific thing is working with Epic Records to turn on the social determinants of health screening, including the screening for violence. So things like that could impact widespread and not rely just on the advocates who are paid and who are experts in this, but making that knowledge and awareness more widespread in a huge, huge health system.
I'm not seeing any other questions in the chat box.
All right. We definitely didn't want to take up the whole time with presenting. So if there are no questions, we can hang around and leave the room open. But also you all can get a few minutes extra to stretch and move around.
Okay, good. And as we kind of conclude this session, there is a 15-minute break after this that actually goes until 2:15, and then at 2:15 we'll have our closing remarks and the closing keynote, which will focus on beyond the physical wounds and the psychological impact of injuries. So thank you so much for your time, and those that did join, if you could refer to the speaker bio that's in the chat, that's also in the on the MIPA Summit webpage. So
Thank you.
thank
Thanks
you for
very
your
much for
time.
having us.
Thank you.
Great. So we'll keep this open for anybody that might have any questions they want to ask before signing off.
And thanks for your help, Jennifer.
Well, and my apologize. I think I had my sessions mixed up, so sorry I wasn't here to do the opening bios.
No problem. Oops. I set a timer so I wouldn't go overtime.
About 2/3 have signed off. There's a few that are still on the line, so we'll see. Because we're not able to unmute folks, they would have to be allowed some time to type their questions in the
Exactly.
chat
That's
box, which
it.
I know can be time consuming. Trying to
Yeah.
think put your thoughts into words, and yeah.
Well, and I also think you get to a point where you're just receiving so much information, it's hard to even formulate questions if you have the interest. So
Absolutely.
there is so much synergy in the sessions this morning. So that was really exciting to see.
I also have the results from both mentees. Jennifer, am I able to send those to you, or who should I send those to so that people...
Yeah, if it's easier to send to me, otherwise I'll just send them on to Heather, who's the coordinator.
Okay, I can actually just send them to Heather. I have her email.
Yeah.
Thank you.
I think most corresponds to them through her, so yeah.
And where are you from, Jennifer?
I'm sorry, Illinois. So,
Oh,
with the state health department. So as the injury and violence prevention coordinator, I've been here for, oh, over 20 years. So I've been part of MIPA for about as long. So
oh, that's great.
yeah.
Yeah, I'm excited to get more active.
It's a great group. Yeah. So there were some member highlights that were done, and I did one. I think there's about 5 or 6 of us that had signed up to just share an overview of why we got involved in the field and in MIPA. So
Oh, that's great. Well, there's a lot of, we're part of, I participate in a Great Lakes region, state office of violence prevention administrator group. So there's kind of a similarity, but it's just focused on, gun violence prevention. But I think there's a real possibility of bringing those two groups together.
yeah, definitely. We have just in fact, my member highlight was highlighting work that we were doing in firearm safety, something that we've been engaged more over the last couple of years. So
Mhm.
this is
All
my
right,
position. Mhm.
that's great. All right, well,
All right.
it looks like people are quiet, so
Mhm.
we can let them go about their business.
Absolutely. All right. Well, we'll see everybody in about half an hour.
All right, thanks so much.
Or no, 15 minutes. Sorry. I don't want to get too much. Yeah, but 15, 20 minutes. Yeah.
Okay,
All
thanks a
right.
lot.
Great.